On Sunday, January 7th, BBC Scotland's current affairs programme, The Sunday Show, focused on the forthcoming UK general election. Here is presenter Fiona Stalker introducing the programme.
Well, election fever is mounting. We're likely to get a general election in the second half of the year, so says Rishi Sunak. One issue which will feature heavily is health and social care. We'll be hearing from the Scottish Government and opposition parties on their plans for NHS reform throughout the programme.
Health and social care was a bizarre choice in a programme dedicated to a UK general election. The area is devolved. Labour is in charge of health in Wales. The SNP is in charge of health in Scotland. A UK general election won't change that. What it will do is determine which party controls health in England and only England. The programme carried interviews with Labour, the SNP, and the Conservatives. The first interview on the programme was Labour MSP Paul Sweeney.
So, in an election year, what are the politicians' plans to reform the NHS? Paul Sweeney is Scottish Labour's spokesperson on mental health. He's with me in the studio. Good morning to you.
Good morning, Fiona.
Scottish Labour leader Anas Sarwar has said that the NHS needs reform and fewer managers. What is Scottish Labour's plans for reform? Just spell them out for me, Mr. Sweeney.
It was an odd first question. Labour won't be able to reform the Scottish NHS after the next UK general election. The SNP will still be the party of government at Holyrood. As it's a UK general election, what we need to know is what Scottish Labour thinks of Keir Starmer's plans for reform in England. English NHS reforms could impact Scotland. For example, does Paul Sweeney support Labour's plan to use the private sector to attempt to bring down A&E waiting times in England?
You're also talking, Wes Streeting, about using more the private sector more in the NHS.
I would rather, as a short-term measure, use the private sector to bring down NHS waiting lists faster. We will work with the private sector to bring down NHS waiting lists faster for the simple reason we've got a two-tier NHS in our country at the moment.
Paying the private sector to carry out NHS work could have implications for the Scottish block grant. But Paul Sweeney wasn't asked about this plan. Nor was he asked about Labour's plan to ask doctors and nurses to work weekends to reduce waiting times.
To get waiting lists down, you're going to ask doctors and nurses to volunteer to work overtime at weekends. They will be paid extra with the money coming in from your changes to the non-dom status. Given some doctors are working in the private sector at the weekends, won't you actually have to change their contracts to make this happen?
The interview was almost exclusively about the Scottish NHS. Sweeney wasn't even asked about the planned strike by junior doctors in Wales, where his party is in power.
And there are further problems for the NHS this winter as junior doctors in Wales vote to take strike action over pay.
Or the real terms cut Labour plans to make to the Welsh NHS budget next year. Something Scottish voters might find interesting.
Welcome to Wales Today. I'm Lucy Owen. The headlines. The Health Minister warns the NHS in Wales will have to make financial cuts this winter. Good evening. Tomorrow, the Health Minister will tell health boards in Wales how much more money they need to save this winter.
The Labour MSP was asked about one area related to a UK general election: immigration. Would Labour introduce special measures for Scotland to help NHS staffing? Here is his response.
But what about overseas and what about immigration? Do we not need more of that in Scotland? How do we do that? Do we need a closer relationship with Europe?
I think there's conversations, we've discussed the idea of looking at the Canadian model for differential immigration. That's been discussed in recent months and certainly in debates in Parliament. So I think there's a conversation to be had there. Scotland has certain different requirements. If you look at the demographics of, say, London compared to Scotland, it's a very different picture. So I think there is an issue there we can look at. But I don't think it's the whole story because, as I just mentioned, there's a lot of people in Scotland who want to be nurses who are not able to do that because of the bleak financial situation they're in.
What Sweeney had to say was non-committal. Some might call it waffle. Interviewer Fiona Stalker didn't press him further. Does Scottish Labour back special immigration measures for Scotland? Nobody knows. In terms of scrutinising Labour on the issue of the NHS in a UK general election context, the interview was utterly useless. Sweeney spent most of the time complaining about the Scottish NHS. It actually descended into farce towards the end as the Labour MSP was asked how he'd fund his own demand for an additional £30 million for mental health.
You know, we've already seen a situation where the Scottish Government have cut the mental health budget. We've proposed reversing that. It's a £30 million cut already.
So that money has to come somewhere. Where would you get that money from, though? Something has to be cut, I presume.
Well, it's a bit like being on a climbing wall, isn't it? You've got your hand in one place and you're trying to look to move to another position. So it's not necessarily that you need to build another arm. You know, it's just about intelligently manipulating yourself into the right position. That's what we're talking about. That's how you intelligently reorganise the National Health Services.
Sweeney's response was incomprehensible gibberish. Labour's plans for the English NHS after the UK general election weren't scrutinised. Yet, this is the manifesto Paul Sweeney and his MSP colleagues will be campaigning on. He faced no questions either on his party's management of the devolved Welsh NHS. Surely Scottish voters have a right to know how Labour manages the NHS where they are already in control and have been for years. What was the interview actually for? The answer came later that evening on Reporting Scotland.
Hello there, good evening. There's been a call to cut the number of health boards in Scotland in an effort to increase efficiency and allow patients to be treated faster.
Scottish Labour says the statistics they've looked at suggest more than 1,500 people died because they waited too long to get treatment once they arrived at A&E. There are currently 14 health boards in Scotland. Labour wants to merge some of these, saying it will reduce duplication and bureaucracy, meaning patients can be treated and discharged quicker.
14 at present, which is way too many for a country of 5.5 million people. We're talking about bringing that down to 3 so that the systems speak to each other, that staff are easily re-resourced, we can share technology and procurement, because right now it's just a bit of a mess. You hear that constantly coming back.
No, the interview was never about scrutinizing each party equally in the run-up to the next UK general election. It was all a setup to facilitate an attack on the Scottish government by Scottish Labour using the NHS.
Scottish Labour's mental health spokesperson says he's shocked at the scale of bureaucracy in the NHS, suggesting a more agile system is needed to boost the sharing of data. Paul Sweeney's comments come after NHS borders last week called on the public to help relieve extreme pressures on local services, with the General Hospital reportedly at capacity.
In the context of a UK general election, there is no such thing as Scottish Labour. There is only Labour. Every Labour MSP, MP, and councillor from Scotland will be campaigning for Keir Starmer's manifesto. That is what they should be questioned on. Why? Because that's what they're urging you to vote for. If an interviewer refuses to scrutinise the UK party manifesto, then you have to ask yourself, why?